Alright, so hi, I'm Ben. I'm going to be your nurse today. I'm just doing a full head-to-toe assessment. Can you state your name and date of birth for me?
Clifford Russell Blood III, August 26, 1992.
Great. Do you prefer to go by Clifford or Russell?
Russell.
Awesome. So what brought you in besides head-to-toe? Anything, any abnormal findings there?
No pain, no abnormal findings, no.
Alright, perfect. So what I'm going to do is to take a quick look, make sure your ears are symmetrical and your eyes are symmetrical, so you both look great. I'm also just going to take a quick look at your head, make sure there's no bruises, indentations, or bumps.
Okay.
So if you stand up, perfect. Perfect. So didn't find anything there. Hair looks like it's going well. I noticed it falling out at all.
No falling out.
Awesome. And then so just take a look at your ears. Any pain or tenderness with that?
No.
Perhaps look at your tragus. Any pain there?
No.
All right. Now let's look at your post-auricle and pre-auricle. Great. Nothing's there. So now what we're going to do, we're just going to take a quick look and make sure, test a few of your cranial nerves. So what I'm going to do here is I'm just going to have you open your mouth, say ah. Perfect. You stick your tongue out and move it to side. All right. Everything looks good. It looks membranes look moist. Lips are good. Your teeth are all there. And then so it looks like your hypoglossal, your glossopharyngeal, and your vagus nerves are good as well. So now we're just going to take a look at your eyes, and we're going to check a few cranial nerves there. So we're going to look at your optic nerve, we're going to look at your ocular motor, your trochlear, and your abducens as well. So what I'm going to do here, just keep standing in front of me. I'm just going to bring a light over and then bring it around.
Okay.
So I'm going to go here. Perfect. So before your pupils were at 4 millimeters and now they're at 2, so they were both constrictive, so pupils were round, reactive, and accommodating to the light. Now what we're going to do, I'm going to have a reflex, so I'm just make sure that you have the light shows in both your eyes at the same time. So you just stare at me, and I'm just going to shine the light right in front of you. Perfect. Light show up in the same spot on both eyes, so we're good to go there. And now I'm going to test out your trigeminal nerve and your facial nerve. So if you just clench your teeth for me, perfect. You puff out your cheeks, and you can smile. Awesome. So it looks good. So now what I'm going to do, I'm just going to take a look at your lymph nodes. Have you had any pain or tenderness in them?
No.
Awesome. So I'm going to say them out as I go through them.
Okay.
So we're going to take a look at your occipital, your postauricular, your preauricular, your parotid and tonsillar, submandibular, submental. I'm going to look at your anterior cervical, posterior cervical, and then your subclavicular. No tenderness with those?
No.
Awesome. So now what we're going to do is a quick lung assessment. So what I'm going to do here, I'm just going to look at 6 parts near the front and 2 on the side, and then we're going to turn you around and do 8 on the back.
Okay.
All right. So each time we go, just have you take a deep breath.
Okay.
All right. Start off here, take a deep breath. Oh, I'm just going to go underneath you there.
Yep.
Okay. Perfect. And if you can just stand up, I'm just going to go on your back too. So start here. Take a deep breath. So your bronchus sounds good, so your inspiratory is greater than the expiratory, so that's what we want. Let's take a deep breath. Bronchoexpiratory sound good. Inspiration and expiration are equal. And I'm going to go down here. Investigatory sound good as well. Your expiration is greater than your inspiration, which we want.
Okay.
Awesome. So what I do here, I just want you to shrug your shoulders up real quick.
Okay.
Perfect. Working well. And now I'm just going to fill your carotid.
Okay.
Awesome. Perfect. So now what I'm going to do, I'm going to assess your cardiac system. So I'm going to say them out as I'm going through.
Okay.
So we're going to go your right second intercostal space on the right side, sternal border. And looking at your aortic, your S2 should be greater than your S1. And then we're going to go second intercostal space, your left sternal border, and your S2 should be greater than your S1. That's your pulmonic. Now we're going to Erb's point, which is your third intercostal space, and your S1 and S2 should be equal. and then we're going to go to tricuspid, which is fourth intercostal space, left sternal border, and it should be S1 should be greater than S2, and then your mitral or your bicuspid valve in the right intercostal space, midclavicular line left side, and that should be S1 is greater than S2. What I'm doing now is switch it over to the bell side and just listen to those again. And here I'm also going to listen to your carotids with this as well. Perfect. So I didn't hear any brute or any normal turbulent blood flow, so everything sounds good right there.
Great.
So what I'm going to have you do now is I'm just going to have you lay down and I'm going to palpate for your apical pulse. Perfect. Just going to go right here. Take a quick look. Perfect. Feels normal. So now what I'm going to do is I'm going to look at your stomach and just also take to see if I hear any abnormal findings there. When was the last time you went to the bathroom?
This morning.
Perfect. No problems with that?
No problems.
All right, we able to go both? 1 and 2?
Yep.
Okay. So we're going to start in the right lower quadrant. Perfect. Right upper quadrant. Upper quadrant. Lower quadrant. Perfect. Bowel sounds so normal. I'm just going to switch it around and look at the arteries as well. So your iliac sounds good right here. Everything else sounds okay. Take a look at your aorta. Now let's look at your femoral. Perfect. Everything sounds good. I didn't notice any brute or abnormal blood flow with that as well. Okay. So now what we're going to do, if you just come to the edge of the bed, I'm going to assess any flank pain you have. So, just going to take a look here. Thank you. So, any pain with that?
No.
Great. All right, so if you can turn to that side as well, we're going to take a look at your lower extremities.
Okay.
Just do this. All right, so we're just going to test your muscle strength for me.
Okay.
So, can you just push that leg up? Awesome. And then push down. Perfect. Push that leg up. And then push down. Great. And then just going to feel right here. Everything seems normal. Can you just pull that leg up for me? The pant leg up?
Yep. Sorry.
Great. Awesome. You look normal skin color, no swelling or anything. So now what we're going to do, we're just going to assess your capillary refill. Came back within 3 seconds. That's great. Now we're going to assess your pedal pulses. Alright. And then your tibial-posterior pulses. And they're both equal, so that's good. And now what we're going to do is you can actually come to the edge. I just want you to be the reflex hammer to work here. So, I was going to hit this. Right? Awesome. Alright. So everything looks good there. And now the only other thing I want to check, I just want to make sure that everything, you have no abnormal findings on the upper extremities as well. Great, and I see cap refill there as well. Great, greater than 1 second. And then you felt all that in your hands?
Yeah.
Can you just wiggle your toes for me? Perfect. And
I can do that again.
awesome. And then just can you feel that? Can you feel the bottoms?
Yep.
Perfect. All right, seems like you're in a pretty clean bill of health.
Great.